Today I am doing an Agnes procedure on jowls and submentum. And so what Agnes is, it's microneedling with radio frequency. So it will help kill fat in the jowls, for example, and then help tighten the skin as well. So I've already used some injectable lidocaine and numbed the area. And can you feel that? No. Okay, great. Here we go. And so this is it. You can hear sizzling of fat. It's always fun. And so there is a little bit of recovery with this because you could bruise, especially in this location. But that's really it. But this is basically it. So we're gonna keep on going here. All right, so here we go again. So really anybody that has fat is a candidate for this. Jowls, lipomas, anything like that. It's a great treatment for, even if you have just like a little bit of fat, maybe you had liposuction and you have a little tiny bit of fat left over, because sometimes that can leave you with a little unevenness. We can get that with Agnes. We can also treat under the eyes, eye bags with Agnes, and submentum, like we're going to do in just a second. I'm just cleaning off my tip here. All right, so here we go again. Here we go. You doing okay?
Mm-hmm.
Pretty easy when you're numb, isn't it? And the only contraindications are if you have metal in your, like if you have a cochlear implant or something like that, you wouldn't want to be doing Agnes, or you have a metal plate in your head. You wouldn't want to do that. But you can do it if you have metal all the way far away from that. Teeth are fine. Metal and the teeth are fine.
She knew what I was
Yeah.
going to ask.
So, okay, and turn this way again for me.
Okay.
That way. So now what I'm going to do is I'm going to do a little what's called tacking. So we're just going to change the direction. So this just helps to bring the tissue upwards, which is what we all want, our tissue to come up. And then we're going to keep on going. I'm going to come back here. Can you feel here?
No.
Okay, good. Hold on, let's just wipe it. Okay, so we're going to pull back and pull up. Okay, ready? So like I said, this is called tacking. You can use this on, you can do this on the neck, on the face, the tacking part of it. You can also call it, we have a little name for it called Agnes lift. And oftentimes people combine Agnes with Scarlett, who's the nicer sister, because Scarlett will tighten and lift as well. But she has 25 little pins that come down instead of just the single pin. And she's a little bit more superficial. Agnes goes a little deeper. So those are the main differences. There are different type of microneedling devices, microneedling radiofrequency devices. And the reason we went with Agnes and Scarlett is because Scarlett is the only microneedling radiofrequency device that has the Na effect, which is spelled N-A. And that means that when the radio frequency is released at the bottom, when the needle goes in and the radio frequency is released at the bottom, the depth to where the needles go, the radio frequency actually comes all the way up through every layer of the skin. So you get a tightening through every single layer of your skin using Scarlett, where you don't get that with other treatments like Morpheus and things. So that is why we went with Scarlett and Agnes, and we absolutely love our results for our patients. So we can even treat these little ear wrinkles right here. So we're gonna go over these ear wrinkles, so it'll help to tighten those. If she had earlobe creases, we could do that too, but she doesn't. But just to, you know, there's all sorts of ways you can use Agnes. So this is just one of them. So there you go. You saw some Agnes for the jowls, and you saw Agnes lift. So if you want to see if it's right for you, come and see us at RejuvenationMD.